what I cut off on my video. This is the final video. The first thing I will do is I'm on 22 part in the lab book. I would put on sterile gloves once again. After performing hand hygiene, I would apply a skin protectant barrier to the healthy skin and around the wound where the dressing, adhesive, or tape will be placed where the wound drainage may come in contact with the skin. I would apply topical medication, foams, gels, gauze to the wound prescribed to ensure the products are confined to the wound and do not impact the surrounding tissue. I will gently place a layer of dry sterile dressing, the other prescribed cover dressing around the wound center and extend at least one and beyond the wound in all directions, alternating the following manufacturer's direction application. Forceps may be applied to the dressing. So, once I've placed my dry gauze, I would, as necessary, apply a surgical or abdominal pad if I was doing the abdomen, or over the gauze at a site, the outermost layer of the dressing with the side of the dressing with the blue line facing away from the patient. Alternately, note the sides of the dressing contain moisture barrier and placed away from the patient based on the dressing material used. Note that that may not be necessary or appropriate based on the covering used in the step in 22. I would apply tape, Montgomery straps, or roller gauze to secure the dressing. Alternatively, may cause commercial wound products of self-adhesion, do not require additional tape. Removed, and then after I would discard these gloves. You want to take that hand right here, you can hold that dressing right there. And ensure that the tape is not too tight, that way it wouldn't cut off the circulation and the pressure wouldn't be too deep embedded on the wound. There's different methods to taping. This is the method that I've learned in EMT school. There's also, I could just roll up all the way around. If I had ACE bandage, I much prefer ACE bandage because it's a lot simpler and it's easier for the patient to take off. Okay. After this, I would dispose of these gloves. And then after securing the dressing, I would label it with a date and time, removing the remaining equipment, place the equipment in the comfortable, place the patient in a comfortable position with the side rails up indicated and bed in the lowest position. I remove my PPE if used and perform hand hygiene. I check all wound dressings at least every shift and more frequently check the needs that may be needed for the wound more complex or the dressing becomes saturated quickly. So I'd date and check this over our pen. So normally I like regular white tape. I don't have any regular white tape. I have what the kit's given me, but I would date it today's date, the time, and I put my initials because I'm the one that applied it. So that's it. Thank you.